For the early recovery, initial post-operative care, you got to help the transport staff using slide board to move patient from stretcher to bed. Identify the patient with two identifiers, usually their name and date of birth or medical record. Attach any existing oxygen tubing, splishers and IV fluids. Verify IV flow rates on infusion pumps and check drainage tubes. Make sure you maintain the airway. If patient remains sleepy or lethargic, keep head extended and support in sideline position. Conduct a initial assessment of level of consciousness and vital signs. Encourage coughing, deep breathing, use of incentive spirometer and PEP device to prevent atelectasis. Assess the GI system for return of bowel sounds. If NG2 is present, check placement and irrigate. Connect to a proper drainage device and connect to all other devices. Assess the patient's surgical dressings for appearance, presence, characteristics of drainage. Unless contraindicated by the surgeon, outline drainage along edges with pen and release in 1 hour for change. Palpate the abdomen for bladder distension or use bladder scanner. If no urinary drainage system is present, explain that voiding within 8 hours after surgery is expected. Males can void successfully if allowed to stand. Measure all sources of fluid intake and outtake. Describe the purpose of the equipment and frequent observations to patient and significant others. Position patient for comfort, maintaining correct body alignment. Avoid tension on the surgical site. Place a call light within reach and raise side rails. 1 of 2 or 3 out of 4. Instruct the patient to call for help to get out of bed. Assess the patient's level of pain throughout this process. There might be like a PCA or pacing control anesthesia device used so the patient could administer their own. But explain to the patient how you plan to control the pain or review orders of what's prescribed. You got to assess the vitals every 4 hours or as ordered. Closely monitor the progress of wound healing and change in dressing as ordered. Monitor drainage and any drain devices such as a JP drain or Hemovac. Provide oral care at least every 2 hours as needed. If permitted, offer ice chips. Encourage the patient to turn, cough, deep breathe, and use incentive spirometer. Monitor functions of sequential compression devices, if allowed or ordered. Promote ambulation activity as ordered. Progress from clear liquids to regular diet as tolerated if nausea and vomiting do not occur. Include the patient and the family in decision making. Provide opportunity for patients to adjust to change in a body appearance or function, verbalize feelings. Like if they had like amputation or something like that. For the covalence phase, assess the patient's home environment for safety, cleanliness, and availability of community resources and help for the patient. Provide instructions on care that the patient or the family caregiver will perform at home. Keep patient and the family caregiver informed of progress made towards recovery. Explain the time frame expected for discharge and provide answers to the individual questions from the patient and family member.